Hi there, it's Dr. Calvis with Liberty Family Medicine here to talk to you about what is the physician role in long-term care education and planning for your elderly. Ideally, this conversation needs to be started, well before your family member is incapacitated, sick, before they have a stroke. Having worked in the ER, though, I know that this is often not possible because a lot of times it's an emergent situation. You've had no time to plan. Um, I think the first thing is it's very important to have an advance directive. Ask the patient, ask your mom or your dad, what do you want? Do you want to be intubated? Do you want all the aggressive measures? Do you want CPR? Do you want, ICU care? Depending on their chronic illnesses, for example, if they've been, battling terminal cancer for a long time, they may not want all of that. And you have to respect that decision. That's actually one of the four tenets of healthcare that all physicians learn in medical school is how to respect patient autonomy. So ask them, have them write it out in an advance directive. Um, Also, ask your doctor, especially if you're suffering from like a chronic long-term illness like chronic kidney failure. Ask for a realistic timeline. Um, and physicians are not wizards, right? We can't necessarily predict the future, but I think it's beneficial for sure to know, okay, does my mom or dad have 1 month? Do they have 1 or 2 years? Um, and then asking them, okay, well, what would you like in the end? Hospice, palliative care, and long-term care facilities, they are not all the same things. And so it's very important that you understand the difference. Hospice is when you really are at the end. You've got maybe a couple days. I think it's max 6 months to live. And at that point, physicians are not giving you any life-saving medications. It's literally just to make you comfortable. Palliative care is a little bit longer. They may um, but again, it just also depends on your insurance and how much they'll cover for. I know a lot of my patients really prefer home hospice care. Um, and but again, that may be very distressing for the family, or so things again just to talk about with your physician. Um, another another role of a physician is we tend to kind of be the middleman because often the sick family member and the family do not want the same things. And so being, having again patient autonomy, respecting what they want, but also appreciating, okay, well, the rest of the family may have to take care of you. Is this something that they can financially handle? Or, is someone gonna have to quit their job and stay home? So sometimes actually getting a counselor or somebody might be more beneficial and having regular counsel sessions. Um, Something else that's really important, though, before any of these conversations even happen, you need to have a good relationship with a physician. I know right now it's hard to find a primary care doctor, but like at least with me, I'm learning my patients, and I know what they like or what they don't like, or if patients just want to be told what to do versus if they're the kind of people that want all the numbers or all the details. And I think there's so much healing that happens in that therapeutic alliance that you can't bill for that, right? Like you can't put your finger on it. But having a physician or a healthcare provider that just listens and kind of understands your needs, I think helps make that transition, through end of life so much easier. Um, so yeah, just to kind of summarize, I think having a good counsel, have a advanced directive, have a good relationship with your physician beforehand, and then also asking your family members, truly what do you want in the end.